Welcome to Let's Talk About Health, an informational podcast that gives you insights on health and fitness from experts themselves that you can apply directly to your own personal health and fitness stories. Come join me today to hear all about what they have to say on health and fitness.
Very
Hello, how are
close
you?
up. I am well. How are you?
I'm doing good, thank you. It was all dark. I was wondering what's happening.
I think my camera was flipped. I just got a new phone, so, figuring it out.
Did you get the 15, the iPhone 15?
No, I'm a Samsung user.
Oh my
I,
God.
I know, I know. I almost feel ashamed at admitting it, but yes, I am. I love it. So I have the
I
S24.
I switched to iPhone 3 years back, so I get it. I support you.
It's, yeah, thank you. Thank you. We have a great camera. I can't get rid of it. So
Yeah. The Samsung camera is actually better, isn't it?
it's I'm biased, but I feel like they are better. Yes.
Yeah. I love the topic that we started.
I know.
Well, let me
Ongoing.
introduce Jennifer Spencer today here with us. And she is fighting a battle for fatigue for all the cancer patients. And she is our nurse and exercise specialist for oncology and cancer. So, welcome. Thank you so much for giving me the time and sharing your experience and knowledge with everybody out there.
God, thank you so much for having me. I truly love educating people on cancer-related fatigue and how to combat it. So I'm very honored to be here with you.
Thank you. Let's dive in. Let me start by asking you my favorite question.
Yeah.
What is health and fitness?
What is health and fitness? I love that. I feel like health and fitness is really, I mean, that's more like individualized,
Right.
I feel like. And it's whatever makes the individual what they need, the tools they need to feel like they are able to feel good about what they're eating, how they're moving, and just how they're enjoying their life with movement.
Right. How long have you been in the field of oncology and exercise specialization for oncology?
Yeah, that's another great question. I have been in oncology nursing for the entirety of my nursing career. So I graduated back in 2010. I kind of fell into the world of oncology. I worked as a nurse's aide on an oncology unit while I was going through nursing school. And then I just stayed. I fell in love with the patient population. And from then on, I've worked in a variety of oncology settings, inpatient, outpatient, within the clinic as an infusion-based nurse. I was a traveling oncology nurse, which actually brought me from Chicago to Boston, where I now live with my husband and my baby girl. Um, so yeah, I've really worked in oncology in like the entirety of my my nursing profession.
What inspired you to get into oncology?
I really just kind of fell into it because I was working as an aide on the oncology unit, and I really fell in love with the patient population. It's very humbling to watch somebody go through such a vulnerable time, but also still feel so appreciative of life and the care that they were receiving. Um, it's honestly a privilege to have worked with all of the oncology patients that I've served. I feel like they've taught me more than I've taught them about life in general.
Definitely. Yeah, we learn more from our patients than we can imagine. Nowhere
I
in
agree.
theory or in books, they teach us how much you're gonna learn actually from your own experience, from your own journey, and from your own patients. So
I
I
agree.
I'm loving this journey of, just working, helping people, getting to serve society. So thank
I
you for being a part of such a beautiful society.
Well, thank you too for what you do every day and for setting up these live videos to help spread knowledge about, different areas and specialties within therapy and healthcare.
Yeah, we need that. A little awareness and a little people need to be aware about what's actually going on with the healthcare system. That's how we will be able to do better, make better decisions, and have a better knowledge and background about how to deal with problems and diseases and different things.
I
So,
agree.
yeah.
It's
Can you tell me a few misconceptions that you usually come across with oncology patients?
Yeah, definitely. So we'll start with the fatigue aspect as we were
Yeah,
talking about earlier before we came on. So about 6 or so years ago, I like that was, I guess, half of my nursing career. I, despite what type of cancer diagnosis I cared for or what treatment they were on, fatigue was always like the biggest main side effect that patients complained of. And
right,
it seemed to happen regardless of their diagnosis, regardless of what treatment they were on. And I was thinking, well, when I feel tired or when I'm, feeling like I'm more like tired and I'm not moving as much, when I move, it kind of helps me feel better.
right,
So I was wondering, why are we not telling our patients to move more? And why are we encouraging them to rest and conserve their energy when they're having this fatigue? It almost seems like they're getting weaker and weaker because we're telling them not to move while they're going through
correct.
treatments that are deconditioning them. And lo and behold, I discovered this whole field of exercise oncology. And there's been research has been going on. The first recorded randomized control trial was done in the 1980s, which
Yeah,
doesn't seem that long ago, but it was also eye-opening to know, wow, like we've been doing research actually
yeah,
in exercise oncology since the 80s, yet like this has not surfaced into daily practice within the oncology
right,
setting. So discovering that really led me to find, wow, like there is evidence-based research that actually supports, strong evidence-based research that supports that our patients should be moving more, especially when they're having fatigue. And I feel like that is a, a big misconception in oncology care, because to this research,
mm-hmm.
prior to this research being available, we were encouraging our patients to rest and conserve their energy. And now, knowing that, yes, there is something that they can do to help improve their fatigue and help improve their overall quality of life in terms of movement, that is, it's such a powerful tool because a lot of times cancer patients feel like they lose their independence or their control because of, this awful disease that they have. And being able to do something for themselves and for them to take ownership, like this is something I can do for me to make myself feel better, is it's like the most powerful gift you can give them. It's like giving them the gift of function.
Right. I, like we were discussing earlier, I myself, whenever I came across any cancer patients, I try not to give as much exercise. If I'm giving bicep curls or any shoulder mobility exercise, if I'm giving a regular patient 10 counts, I would go to 3, 5, not even touch 7. So that's how low I was doing. And mostly I was focusing more on passive exercise, passive range of mobility rather than active. And there was it's coming to light now that we can actually fight the fatigue, but
Yep.
we were told that how about pain. My question is, like, they undergo chemo. Does that affect the exercise protocol? Definitely, but how to what intensity does it affect the exercise protocol?
Yeah, that's a great question. So, as you know, working with patients in really like any specialty and
Mhm.
just the general population, we're all individuals and we're all unique. So, we all have our own level of physical fitness.
Correct.
And someone may not have been exercising for a couple of months leading into their diagnosis and their treatment, couple of years, maybe they've never exercised at all in like their whole entire life and now they're going through cancer treatment.
Mhm.
So the guidelines really have their own unique starting point. So although there is a target, which we can talk about what's like recommended overall, even though there's a target, it's really finding what is individual to that patient and where their starting point should be, especially when they're going through treatment, because we still want them to move if they can and when they can during treatment, because it has been proven to help their outcomes. And even more research is evolving that it can also help with treatment delays and treatment completion rates. So we really do want them to move when they can, but it's also making those adjustments to, when are your off days, like after you get treatment? And let's lower the intensity and the duration. And then maybe once you start to climb back up and feel better, getting closer to your next cycle, we can do a little bit more. So any movement is good. And to answer your question, when they're going through treatment, it's just very important to understand their starting point, understand the cyclic nature of their treatment, and that they're going to have bad days and good days. So you have to adjust the intensity and duration. And overall, after they do exercise, they should feel like they have more energy. They should feel better than when they started. So if they leave a workout or a rehab session or whatever they're participating in, if they're exhausted after, then maybe they did a little bit too much and we have to scale it back. But the overall goal is to make them feel better after they're done exercising compared to when they started.
Well, on the days of chemo, do you still recommend exercising, or you give it as a rest day?
Yeah, they could still exercise. It is so individual.
What?
It's so individually based. It depends on how they're feeling. It also depends on certain treatments. Um, there's still like mixed research about this, and we probably need a little bit more research to back this up.
Right.
But some chemotherapy treatments are considered cardiotoxic.
Right.
So the recommendations were not to exercise within 24 hours of receiving cardiotoxic agents such as like adriamycin.
Mm.
Um, However, research is being done to kind of see like, is that really what we should be doing, or can they be doing a little bit more? Um, so always, if they are on certain agents that can affect the heart, you would, check with the oncologist and just make sure
Right.
they can be moving based on their recommendation and based on the patient too. Maybe they feel really ill. That usually they feel good the first day
Right.
because the chemo hasn't really kicked in, but maybe even just getting to the appointment is a lot for them,
Mm.
and like they have to walk a lot or they take the stairs, or just like getting into their car and out of their car can be a workout in itself, so that might be sufficient. But otherwise they can definitely like exercise on their days.
They're so much more stronger than we can imagine.
Yep,
Yeah.
completely. Complete mentally, emotionally, and physically. I think another misconception is that you're too, they feel like they're too old, they're too deconditioned,
Right.
or they're on certain treatments that affect muscle and bone mass, like hormonal therapies, and they think that they can't benefit from an exercise program. But like, in fact, they can.
Yeah.
And studies have shown that even those that are like more deconditioned can benefit the most from moving more and participating in an exercise program.
Right. Yeah, I can see how. Because you're
Hmm.
starting from, it's complete different change for body starts feeling more healthier. Right.
Exactly.
How do you decide the base or the starting point for each individual?
Yeah. So everyone, yeah, like I said, everyone's a little bit different. So it kind of depends. It depends on what they're doing leading up to their diagnosis and their treatment.
Right.
So usually I try to stay at their base from when they start, and you increase by 5 to 10% in increments based on their cardio, aerobic exercise, and their resistance exercise. And then, for example, sometimes patients or clients can come to me after they're doing physical therapy if they had like a mastectomy or they had some kind of surgical operation where they had to do physical therapy first.
Right.
You kind of take, where they left off with the physical therapist, and then you start incorporating those exercises into their daily lifestyle, and then you just tailor up from there.
Right. So it's just similar to inpatient, outpatient uh, setting.
Kind of, yeah, that's a good way to look at it. I think like with all the involvement of the and exercise oncology and the benefits of exercise to the cancer population, it's like very important that physical therapy and exercise professionals work
Correct.
together, so that they can refer patients back and forth. Um, because yeah, sometimes you know, they're not ready to see an exercise trainer and they definitely need to see physical therapy first. And then that handoff from the physical therapist to the trainer is so crucial because how many times as an oncology nurse, how many times have I sent a patient to physical therapy and they do great and then they stop doing the exercises and then they're weak again and they go back a couple of months
Mhm.
later. But if there was somebody to help like smooth that transition
Right.
so that they can start to incorporate those exercises and build on them within their life to make it really like a lifestyle change, how wonderful would that
Yeah.
be? And vice versa, patients and the population itself, like you have ebbs and flows, life happens, you have
Yeah.
setbacks. So you may have to go back to physical therapy. You may have developed a new pain or like something's new on imaging or, something that the trainer can't take care of and you have to go see a physical therapist. So it's great to have that fluid communication and referral source.
Right. I reached out to you because I am a licensed lymphatic therapist as well.
Oh,
So
I love that.
yeah,
I
so I love
love that.
the coordination between PT, exercise training, and lymphatic therapist because, like you mentioned, mastectomy and a lot of breast cancers come with lymphedema. So it's so
Yeah,
crucial to have a not to have a background and a little bit knowledge about what's going on with the lymphatic system.
definitely. The
Yeah.
lymphatic system, I feel like doesn't get enough of time in the spotlight
Yes.
when like edema and lymphedema can affect quality of life and functioning so much,
Yes.
um, which is another field that exercise oncology research showed, it's actually good for patients at risk for or with lymphedema,
Yeah.
specifically breast cancer related lymphedema, to participate in a resistance program as long as it's very slow and progressive and not doing, heavy lifting right away, of
Yeah.
course, if ever. But before, and you probably know more of this than I do, but before we would just recommend, they lift a gallon of milk or lift their purse to the affected extremity, like for the rest of their lives,
Yes.
years ago.
Yeah.
And now it's amazing how different research has evolved and the recommendations.
Lymphedema is very new too. So there's so much research going on and a lot of light towards lymphedema is very recent. So we're learning so much about the lymphatic system, the lymphangiome, the function of, how just by touch and soft movement, you can drain the lymphedema.
Yeah,
I was blown away when I did the workshop and it was
yeah.
amazing.
I love
So I
that.
yeah, I have a few. I have did discharge now, but I had a few lymphatic patients, and I had the opportunity. It was not so severe, but it was pretty swollen, and that's how I have a very soft corner for oncology, lymphatics, and all the field. But I'm like, before talking to you, I was so scared to prescribe any exercise therapy intensive. Definitely. But now I feel a little more comfortable to set
Good.
a patient's starting point and to start knowing that it's safe.
Yes. Yeah. And I think that's a lot of healthcare professionals' hesitancies are, we want to make sure what we're recommending for our patients is safe and effective because we only have so many hours in the day and there's so much to do when you have a cancer diagnosis,
Hmm.
especially like you are running back and forth to appointments. So whatever we're telling you to do, we want to really make sure that it's going to help you live a better life.
Correct. What exercise protocol do you like to follow? Like, can you give me a gist of exercises that you walk your patients through in a session?
Yeah, so it depends on the patient. Usually when I meet with a client, we do an initial consult so we can look at their posture and their functional movement assessment. And then based on that is what exercises are recommended. But a lot of times it's those core, like it's the core exercises to really help you like build a better posture. So a lot of core work, opening up the hips, opening up the hip flexors, opening up the chest, strengthening the shoulders. Um, it's usually a mixture of exercises to focus on
Right.
those, but it's very patient specific because if somebody has a really tight chest, then you're not going to, work on strengthening those. You're going to work on relaxing those or opening them up, I should say, not relaxing, opening up the chest muscles.
Right.
Um, so it's it's very dependent on the client.
Right. Right. How would you approach sleep, exercise, and diet in your clients, in your patients?
Yeah. So in regards to sleep, the evidence has shown there's a moderate amount of evidence in exercise oncology that aerobic exercise can help with sleep. So I would incorporate aerobic exercise within their program.
Mm-hmm.
And then in terms of diet, just because I am an oncology nurse as well as a cancer exercise specialist, I very much value the knowledge and expertise of oncology dietitians.
Mm-hmm.
So I do not offer nutrition advice to cancer patients. I do refer them back to their oncologist
Right.
dietitian.
So that's how you would go about diet, exercise, and is there any point or focus that I might be missing that you're particular in cancer patients?
No, I think really the other main point to drive home, I guess, with exercise in the oncology population is yes, like we know that now we know that exercise can help physically with the patient with the cancer patients. It helps with cancer related fatigue, strong evidence support. It helps with anxiety and depression as well. And it also helps improve their physical functioning and quality of life. There's also like more research that's trickling into their outcomes. So exercise has also it's being proven, it's evolving exercise oncology research that it can help with treatment toleration. So
Right.
when treatment is tolerated better, there's less treatment delays and there's better treatment completion rates. And when there's better treatment completion rates, that's associated with improved survival.
Mhm.
So, although exercise seems like just like, oh, it's going to make you feel better and maybe, it might help. Like it can actually have like a big ripple effect into cancer patients' outcomes and survival rates. So I'm very, very excited to learn more about what the new research is going to tell us in regards to that, because I think that will really help embed exercise as part of the standard of oncology care.
Right. I was gonna ask you about how do you deal like with pain as stream in, especially in cancer patients. They deal with a lot of pain while going through chemo, while not just fatigue, it's a lot of pain. Does exercise help relieve the pain?
There's not enough evidence to show that yet. So there's low evidence in that field based on the last American College of Sports Medicine. That's the most updated 2019 cancer exercise guidelines. There's not enough research to show that exercise can support pain management.
Right.
Um, However, in my own practice, not evidence based, but just in my own experience of patients who are on certain hormonal treatments that can cause more of the like joint and muscle achy pain
Right.
when they move more, it does help. Just based on my conversations and symptom management with them.
Right.
So I do think movement can help in that regard, but there's not enough evidence to show it can actually be like a recommended intervention for pain.
Right. How do you keep the patients motivated? Because I see
Yeah.
they need to accept to begin with that they have to do exercise, that they have to do they just have to move around. How do you keep them motivated?
Everyone learns and is motivated differently. So if
Right.
you have to be a little strategic, because everybody, yeah, is has different motivational factors. So
Mhm.
I always start with education. I feel like a lot of times people can misinterpret physical fitness, physical activity, and exercise and kind of lump them all together.
Mhm.
But when I explain the differences to patients and how exercise is a structured form of physical activity that can improve the components of physical fitness, and when those components are improved, then you can move better with, less pain, less constraint, and then you're going to move more, so then you'll exercise more, then you'll keep, it's like a domino effect. So I feel like explaining how exercise fits into that puzzle is important. And then, some patients that are on certain treatments just are not going to have the motivation to exercise, especially certain hormonal ones. So having them make a schedule and just try to stick to it, but like actually plan, like I'm going to put my shoes out. I'm going to dedicate an hour here or 30 minutes here, and I'm just going to go and do it. Some people are very plan oriented, and that works wonderful. And some people are social oriented. So they like to be with a friend or have somebody with them to help encourage them to exercise. So a lot of times we recommend a buddy, and that helps keep you accountable. Like, I'm going to meet you at this trail and we are going to walk for 10 minutes, 30 minutes, however many minutes it may be. And sometimes that also helps with motivation too.
Do you come across a lot of depressed and a lot of patients that undergo mental fatigue?
Yeah. So cancer related fatigue is actually like, uh, it has it's multifactorial. So cancer related fatigue includes physical, emotional, and cognitive exhaustion, just like an overwhelming feeling of being exhausted that is not related to recent to activity, and it's not relieved with stress. So I feel like that mental fatigue is kind of encompassed in cancer related fatigue.
Mhm.
And we know that the best thing to do for it is to exercise based on the evidence. So when patients do complain of that, I do definitely encourage exercise and hydration if as long as they're not on a fluid restriction. And also sometimes that anxiety and depression plays a role in that. So it's kind of hard to know. It's, are you feeling tired because you are feeling that way, or are you this way and therefore you're feeling
Right.
tired? Luckily, we know that can't exercise combats cancer-related fatigue, anxiety, and depression, and there's strong evidence to support it. So recommending them to move is really going to hit all those markers and hopefully help them feel better, like mentally and emotionally as well.
Right. Yeah. Do you think you would you recommend outdoors exercise,
Oh,
outdoors
yes.
workout, or indoors workout?
Definitely. I would definitely recommend to go outdoors, especially before it gets too cold,
Yes.
for us over on the East Coast. But always being in nature, fresh air. There is some evidence that supports that being in nature can also like further improve certain markers in cancer patients. So like in aerobic capacity and just feeling like an overall sense of well-being. Um, I would definitely recommend to exercise outside. Yes.
What are your inputs on telehealth?
Yeah, I like telehealth in general, or for or for an exercise professional.
For exercise professional.
Yeah, I I honestly was a little skeptical.
Mm-hmm.
So I started Fight the Fatigue in Chicago, and I was going into people's homes to do exercise programming. And then, of course, COVID happened. So transitioned to virtual. And that's what I do now is just virtual programming. And I was in my head, I was thinking, how am I going to do these assessments virtually, especially like posture ones or range of motion for the arm and shoulder. And it actually has been working out very well. And it helps break down that barrier of transportation
Mm-hmm.
um,
Yes.
to patients. So I feel like it's a very, very valuable resource. Definitely increases accessibility, and that can be a huge, huge barrier for patients to be moving.
Do you use like certain apps to record their posture, their ranges, their muscle strength?
Yeah, so I use Zoom for my client
Right.
appointments. Um, and I'm old school and have forms and everything that I write on. But the programming gets delivered through an application. I'm transitioning which one I use right now, but I used my PT Hub in the past, which was great.
Yeah.
But I'm trialing EverFit now. It is wonderful how great the applications can send out the program to the patients and have the videos included so they know what to do.
Right.
Um, yeah, it's very, very user friendly.
What is the last research that you read that really got you very interested and hooked up to it?
Oh my gosh, that's so funny you say this because after we got off earlier, I checked my email and the National Comprehensive Cancer Network uh, sent out an email update about new patient guidelines, and one was specific to fatigue and cancer. So I
Okay.
quickly read through that, and I was so excited because there are cancer clinical guidelines from the NCCN on cancer-related fatigue, but I have not seen one like specifically fatigue and cancer for patients. So I'm so excited that that's being sent out and that those resources are being developed.
Yeah. Um, if it's possible, if you can share the research and the links with me, and I can spread it around, and we'll see what guidelines, because I have a few friends, they're starting their own practice in oncology, physical therapy. So it will be
Yeah.
really helpful for people out there.
Yes, definitely. I will send you all of my resources.
Thank you. You're so kind and sweet.
Thank you for having me. This has been really great.
Yeah. Can you tell me who's been your role model throughout your journey?
Oh man, I'm gonna fangirl here. Um, I'm gonna total fangirl, but she has no idea who I am. There's a researcher, Katie Schmidt, that, oh God, I have my book downstairs. She published the Exercise Oncology book. She was the editor of it, and she really like led the way in exercise oncology research when she was working with ACSM back in 2010. So she is just like, she's my idol, and if I met her, I would be I would be speechless.
I can see that. I can see
Yeah.
you getting so excited already.
Yes.
Do you work at a hospital or like a clinical setup right now?
Yeah, I work as an oncology nurse. I work at a cancer center
Right.
here in Boston, and then with Fight the Fatigue, I work remote. Um,
What are your plans for Fight the Fatigue for the next 2, 3 years?
yeah, very exciting stuff. I will have a table at a major nurse navigation conference
Okay.
coming up in November. So I'm hoping that can really open up the doors to spread the word about exercise and its benefits to the patients, to help increase referrals,
Right.
to just cancer exercise professionals in general. I'm also going to work on making and creating CE courses for nurses, specifically to in regards to exercise oncology. So that is coming down the pipeline too.
Wow, that's so exciting.
Yes, very exciting stuff.
I'm so happy for Fight the Fatigue. We're
Thank
fighting.
you.
We're uh we have warriors. We have to be out there. And if in any way I can help you, I am here.
Oh my
Just let
gosh.
me know.
Pavna, you are so
I
sweet.
will I will I will get a whole team of PTs ready for you. That's
Oh
my
my gosh.
guarantee.
Oh my gosh. You're too kind.
Yeah.
We help each
Oh
other.
yeah.
We help each other.
It's
Because if
not
we
an
don't have each other, it's not, what's the point?
Yeah, it's
Yeah,
it's not an individual battle. It's a group battle, and it's we have to fight together. We have to have a community.
agreed.
That's the reason why I started Let's Talk About Health, because I wanted to create a community, a platform, just where people with expertise can come and comfortably talk about their experience, like yourselves. You've been in this world and you have changed so many misconceptions just with just by talking to me. You cleared so many wrong ideas that were drilled in my mind about how to approach patients who have cancer. And now when I see patients with cancer, I'm going to definitely approach it in a very different way. I'm going to study more about those guidelines and try to
Yeah,
educate myself better, so I am in a position to educate others. So thank you
I love that.
for being a fighter
Of
and fighting.
course. Yes. Thank you so much for having me. And I want to learn more about lymphedema and how you work with your patients and in
Definitely.
another time, but I would love to hear more.
I will send you my resources too about lymphedema. I'll send
Okay, perfect.
Yeah, it's very interesting. It's very the techniques are amazing, and I have never seen how much effective a light touch and just a light movement. This is literally the movement that you do for lymphedema.
Wow.
I never thought that that light touch can make so much of a difference. So
Mm, I wouldn't think that either. That's amazing.
yeah. Can you tell me what is one piece of advice that you would give to 18-year-old Jennifer?
Oh man, to 18-year-old me, I would say en enjoy moving without pain. Because as you get older, it gets a little bit harder.
Right.
Yeah. Really appreciate it.
Definitely. Well, thank you so much for coming on this platform and speaking with me. It was an honor. And thank you
Thank,
for fighting the fight.
oh my God, thank you for having me. I really enjoyed
Yeah,
it.
likewise. Well, I'll stay connected. I'll send you all the resources, and if I have any questions, I'm gonna ping you. Can you
Yes.
tell where everyone in our audience can find you?
Yep, you can find me at Fight the Fatigue Fitness on Instagram. And if you have any questions, you can email me. I'm at Jenny at fight-the-fatigue.com.
I'll leave your description. We'll have the podcast and all the information for your
Oh,
social
I'm so
media.
excited.
And thank you so much.
Thank you, Bhavna. Have a good night.
You as well. A very tight hug to the little baby girl. I'm very
Thank
excited to
you.
meet. You should come visit New York very soon.
Yes, you would love it.
Yeah,
She likes all the lights.
I bet Christmas would be cold, but it would be perfect.
Yes, agreed. Maybe we'll make it down there.
Yeah, let me know.
All right. Thank you, Bhavna.
You're welcome.
You have a great night.
You as well. Bye bye. Take care.
Bye.
Thank you for listening to our talk about health. You can follow me on Instagram at bhavna.devnani, on Facebook at bhavna devnani, and we'll leave all the information in the description below. Thank you.